This week, nurses with the Minnesota Nurses Association shared the results of a survey that looked at why so many nurses are leaving that profession. In fact, 2,400 nurses left their jobs just last year. 500 of those nurses shared why. The number one issue for quitting, nurses say, is stress, burnout. The second, chronic understaffing. ABC 6 News anchor Laura Lee sat down with a registered nurse to hear why this is a growing problem and what they say needs to be done to fix it.
Joining me now this afternoon to talk about the Minnesota Nurses Association's new survey that just came out is Carrie Mortrud, who is a registered nurse. Why do you think there is such a huge a departure of nurses in your medical industry?
We have the most licensed nurses in Minnesota than we ever have before. Unfortunately, we have less nurses willing to work in the circumstances and the environment that exists right now. Nurses leave their shifts too often, if not every day, concerned about the care that they delivered, and even to the point where they're worried about protecting their professional licensure, and so they have chosen to leave.
And Carrie, you're a registered nurse yourself. Can you just walk us through some of the expectations a nurse in this day and age, in 2023, what are some of the expectations nurses have when they walk in through the door to a shift?
So it has changed drastically, as everyone knows, as medical technology advances and science advances, and we are able to save people and help people heal that just a few years ago we might not have been able to, right? Like they would have passed away, they would have died, and we're able to keep them alive. There's robotics and all of these things that are sustaining life so much longer than we ever have before. The problem is that the complexity compression of that, meaning that nurses are expected to give care to these very, very acute sick patients in a shorter amount of time and with a lot more patients to care for. And so we are unable to deliver the quality care and the safe care that our licensure expects us to. So under the Nurse Practice Act, in any state, a nurse has a duty to advocate for patients as well as a duty to deliver safe care. And when we don't have resources to do that, it's the nurse that ends up having to answer for that, even though it's a system-wide decision. And so I left more than 15 years ago because staffing was bad. And so this isn't all of a sudden new thing because of COVID, the pandemic, or anything like that. This is a problem that has existed for quite some time, and it just continues to get worse. And nurses have said, enough is enough. I'm not going to risk my licensure that I worked so hard to get, my sanity, my emotional well-being, and my patient safety any longer.
What needs to happen, Carrie? What needs to happen to guarantee that nurses are mentally and healthy and they're safe, but also to make sure that there is that patient safety factor?
The environment in which nurses are working right now and caring for patients has to change. And we 100% firmly believe that if nurses are invited to the table to have the discussion, and not only have the discussion, but help make the decision on what's appropriate to deliver that safe care, that will change things. 90% of the time, when they ask management for assistance and for help, there's no answer. There's either no answer, they get a voicemail, or they get met with a statement of, do the best you can, say a prayer, cross your fingers that nobody else comes in tonight. And so this idea that we can just continue on like this is unacceptable to the nurses, and the nurses are trying to tell everyone this has to change. But as our members look and see large cranes all over their campuses, shiny new buildings, hospitals closing in the middle of pandemics, we start to wonder, why is this all happening? We don't have the resources inside the hospital to deliver care to the patients that are already there, let alone the ones that might be coming.
Wow, and this message being brought to lawmakers at the state capitol, how did they receive your message?
So today we had a press conference to talk about the survey that we did on why nurses are leaving, and over 2,400 nurses left hospitals in Minnesota just in the last year. And the majority of the reason for them leaving was that staffing was unsafe, and the stress that that causes was enough to force them out the door. It's not because they're deciding to become artists or teachers or do something else fun. It's because they're terrified of what might happen if they stay. We are trying to move legislation that would hold the hospitals accountable. I have been at this so many times in so many years, and we have attempted to do the right thing, talk to the hospital administrators, negotiate, work in between legislative sessions. What can we do to work together? Because we see this as a win for everyone. That if there's more nurses in the hospitals taking care of patients, that's not a bad thing. We have nurses coming out of school that are literally shell-shocked and can't believe this is the way things are. And when they get into the acute care hospitals, they are literally astounded that that is not even something that can be considered, because it is so fast-paced. We are so short-staffed. The patients are so sick, and no one seems to respond when we call for help.
And with this Bedside Act bill, what do you hope to achieve? Obviously, to increase staffing levels, to make it appropriate for hospitals, but funding as well. What else?
So there is reinvestment in loan forgiveness. We want students to be able to continue their degrees. We all know that the mental health crisis is not helping as well, and that patients are escalating to the point where it's becoming violent, and nurses are being injured, and they are leaving because of that as well. And so this legislation that we are hoping to pass this year is very comprehensive and is called Keeping Nurses at the Bedside Act, because that's what we want to do, is keep nurses at the bedside and not have them looking to go elsewhere.
Yeah, and the need is there. The need is there. Carrie,
Absolutely.
again, thank you so much. Again, Carrie Mortrud, Nurse Staff Specialist with MNA. Thank you so much for your time today.
Thank you very much.